Hello everyone, this is Health Highlights. My name is Simon Ashley. Health Highlights is a show about health, health professionals, and the people and the stories behind the names we often hear about, but we seldom get to meet. And it is actually Mental Health Month this month, and particularly this week it is Mental Health Week, so we wanted to highlight an organisation that's doing incredible work around mental health in our community. Now, I don't know if you realise it or not, but suicide, unfortunately, is the major cause of death in our young people in Australia. And the Beyond Blue actually say that 1 in 4 young people suffer from some sort of anxiety or depression. So these are really sobering statistics. And so it's wonderful to know that we've got an organisation that is actually in our community that is looking at helping our young people combat some of these issues. Lake Macquarie is actually one of the worst also in our state. So it is great to have Dale with us today. Thank you, Dale, for coming along.
Thank you for inviting me. I'm happy to be here.
So can you firstly share with us a little bit about, if people out there don't know what CALM is, who are you and what do you do?
Sure. So I'm a specialist youth support worker. I'm employed by CALM, which stands for Community Activities Lake Macquarie. We're in Toronto. So there is a youth development officer who works here, and he put in a tender for some funding around some youth mental health raising awareness and suicide prevention. They got the tender, and so they employed me, and so CALM's been around for about, I think, over 32 years, doing a lot of different, very grassroots, community-based, community-led projects. So they've done, Youth Frontiers is one, Top Blokes is another project. Lots and lots of different projects that they've run. So the Bright Minds project, which is what I've been employed to do, that's what we're basically doing and what we'll talk about today.
Awesome. So can you tell us?
Yeah, of course.
Bright Minds. So what's it about and what are you aiming to achieve in our community?
Yeah, so Bright Minds actually came about a couple of years ago. There were a group of young people who were really active and wanted Lake Macquarie really engage in conversations around mental health and reducing that stigma and raising awareness. So they put together a youth reference group. A part of that was to lobby for a headspace to be put in Lake Macquarie, which didn't go ahead, but it really paved the way for this sort of project to make a stamp and have a campaign that's really Lake Macquarie specific for locals here, and that's how it's kind of has grown. They've done lots of different things. They did like a poster campaign. They did advertisement on bus stops about how to seek help and that you're not alone, and they did a lot of things like that. So now it's a little bit different. We're linked to the Black Dog Institute's lifespan strategies. So we've had some interest from the Ministry of Health, and they're really keen for us to get out into schools, promote help seeking, talk to our young people about trying to normalise mental health, and to talk about suicide prevention, and then do gatekeeper training. So that might include teachers, police officers, health workers. It can be basically anyone over the age of 15 to do some gatekeeper training in suicide intervention and suicide prevention, just some basic skills. So it's not just up to our services and our organisations on the front line to kind of help people who might be at risk. It's up to all of us. It's everyone's business. So that's a part of the project, I guess. So and we're very excited. We're launching the project officially next week at Charlestown Square, across from the Reading Cinema. So if anyone's down there on Thursday night, afternoon, pop down. We've got some entertainment. We've got some merch giveaways. So
great. Wonderful.
So, what's going on?
So obviously we're looking at you particularly focusing on suicide. So you're seeing a lot of the kids in our community. Can you sort of give us a bit of a snapshot of what's going on, how our kids are coping, and what are the reasons for some of the problems that we're seeing? Yeah,
so the reason, one of the theories around why the statistics and the prevalence in Lake Macquarie is quite high, in terms of, looking at the state stats, it can come down to access. So Lake Macquarie is quite a large region. We're all around this massive lake, beautiful lake, but it does make things a little bit difficult. So young people are accessing services in either Newcastle or the Central Coast. So I think that has a bit to do with it. And then also, like lots of communities, there's a lot of taboo and stigma around suicide and around mental health in general. And I think that plays a bit of a part in it as well. And people just don't know where to go for help as well. So I think that those are the theories around it. So, yeah.
Okay, and so what's the message that you guys particularly with the Bright Minds, have for the young kids? Like, so what are the, like, self-care and self-help is really important. How and what's the message that you're actually delivering to these kids to actually help them?
Yeah, so it's about having conversations with each other. Usually the people that know us best are the ones that pick up on any changes in our moods or our mental health before we even do. So I think a message is, if you do notice someone close to you, simply asking, I think like the Are You Okay campaign, really speaks to that idea that, sometimes for someone with having an issue, it is hard to step out of your comfort zone and ask for help. We live in a society where no one wants to ask for help and we want to do things ourselves. So I think it's around building that mental health literacy in that way, but also being responsible and having each other's backs as well. So if you are a parent or a carer or a friend, and you do notice a change, or co-worker, and you notice a change, just say like, hey, you don't seem yourself. Is everything okay? Is there anything I can do? I think it's trying to normalise that sort of communication, get people talking about it. So that's what we're hoping to encourage in a really interactive and fun way, not in a lecture-y sort of way. So
and look, if I'm a parent or a teacher or even a friend, what are some of the signs or things that we should be looking at in our friends? Obviously, as you alluded to, something's changed, but what other sort of specific things?
So you might get a gut feeling, and I think sometimes we tend to try and suppress or ignore our gut feelings or intuition. So I think listening to our gut feeling, or actually believing our own gut feeling, is the first step to recognizing it. And I think it's really hard with young people because loss of appetite, lack of sleep, or changes in sleep pattern, withdrawing, feeling irritable. There can be all sort of normal things that teenagers or young people go through just normally, but I think it's if it's over an extended period of time, and it's something that's occurring regularly, is when you might want to have the conversation with the young person about having a chat to a health professional, or seeking out a service like Headspace, or going online looking at Beyond Blue, or so I think it's, if you just pick up on something, even if it's the slightest change, withdrawing from activities that they usually would be psyched about, just checking in and having those open conversations. So
that's so good. That's great. So then, if there's someone out there who is actually needing some help, what are the avenues or the pathways for them? Where should they start, and what support is out there?
So look, speaking from my own experience, I always feel better after I've spoken to someone close to me, which might not work for everyone, but it certainly has worked for me. So I think speaking to someone who you are close to, can be a trusted adult, it can be a friend, a relative, an aunt, someone who is a sibling, someone who you can go to for some as a sounding board, some real advice. Sometimes that helps kind of lay the land of, okay, I think I might need a little bit of extra help here, or even they will be like, I'm out of my depth, you might need to go and seek a service to help support you get through this whatever tough time. So that's usually a good step, is just talk to someone else. Sometimes that's a huge relief. If you're not sure, there's so many services and so many options. You've got, particularly for young people, you've got Kids Helpline. So they're a crisis line that you can call. You've got Lifeline as well. They're a 24-hour, crisis line. Headspace, they have a lot of e-tools that people can go on and, just assess maybe where their headspace is actually at. I think Reach Out's the same. And Beyond Blue. So you can do these online kind of screening tools, and they ask you a few questions, and then they might say, maybe your stress levels are medium to moderate. It might be a good time to give someone a phone call and book in. Your GP is not necessarily one that people know about, but definitely chat to your general practitioner, your doctor, your family doctor. Just say, I just don't feel right, or whatever's happening, because they can then link you in to support services. It could be a public service, it could be a private, and then you've got all these options available. And I think that's the biggest thing. Sometimes it can be overwhelming and people just don't know. There's too much. So kind of knowing what your options are and doing research, if you are the type of person that likes to go on and just analyse and look at everything, sometimes doing a bit of research can help. And if you access a service, and this is the biggest one, I think some people access a service and they might not hit it off with a counsellor, or they might not liked the service for some reason, and then they kind of are deterred from going to any service. And I would say, like your GP, shop around. If you're not completely happy or you just don't click for whatever reason, I'd say shop around. And it's always good to have a support person with you, or making that contact, having someone with you to help book an appointment or even contact a service. So
can you just list off for us the things that Calm actually does? Because I'm sure there's some people out there who would love to maybe support in some way, and maybe give us an idea of how people can out there actually support it.
So there's the youth development team. So there's Youth Frontiers. They're a mentor program that go into schools. It's actually finishing up at the moment, but they do have a showcase that's on the 1st of November this year at, I can't remember, it was in Newcastle, and it's where all young people who've been mentored by a community member who volunteers, so it's really, awesome. really awesome program. They work on different projects to do with community and civic duties and stuff like that. So one of the examples is a young guy. He developed a physiotherapy program for old people. So he went into a group and he did some demonstrations. He actually had a manual that he put together. So that's one of the programs. There's like a littering and environmental program. So lots and lots of different ones. So that's one project. They also do Top Blokes, which is some guys go into schools and they sit down with young guys and they talk about different topics ranging from relationships, sexual health, what is masculinity and all that sort of stuff. So it's about role modelling and in a really positive way. So that's another one. The Bright Minds project is another. So Calm also have a child and family service. So that's early intervention. People self-refer, or other services or schools will refer families who just might be in a bit of need, and so they'll be put through to our child and family team, who so they have caseload. So so there's lots of different. There's an USH centre, lots of different things going on. So
and look, I've been in Lake Macquarie now for 15 years and I've never really heard about Calm.
No,
so
it's I hadn't either until this job popped up. They're a nice, quiet little NGO. Very relaxed, and I think Calm speaks for itself.
It does.
But they do run on grants and project on a project base.
Wonderful. Well, look, there you go. You've heard something probably that a lot of you may have not even realised it was in Lake Macquarie, and it's just wonderful to hear all the great things that you're doing and the support that you're giving to our kids, because it certainly is a needed thing in our community. So if you want to find out any more information about Calm, their website and their contact details will just be below there right now. If you have any questions at all for Dale, please feel free to comment on our Facebook page, and I'm sure she'd be happy to answer a question. Look, thank you so much for coming in, Dale.
Thanks for
We
having
really appreciate having you. Look, thanks for joining us. We'll see you next week, 12:30, same time. We'll have an incredible interview lined up. Remember, healing is a gift, health a responsibility. See you next week.